I'm glad you could join us on our little video here on our website for peripheral neuropathy. If you currently have neuropathy or been diagnosed with neuropathy, you're in the right place. Number one, having neuropathy, which is essentially problems with the nerves of the body, and in particular the nerves that go out either to the hands, down into the hands or arms, and even or into the feet or legs, to the point where you get numbness, tingling sensation. You may lose some sensitivity in your hands as well. You may have trouble buttoning a shirt, holding a pen. You may even have difficulty walking. You might describe it, as many of my patients have, as walking on pebbles. You know, it just feels like stones are on the bottom of the feet. Or you may even feel, you don't even feel your feet when you're walking. You're kind of walking flat-footed because the lack of sensation isn't there. So if you have been currently diagnosed with peripheral neuropathy or any other type of neuropathy, there may be help for you. And that's one of the focuses of my office, is helping people with chronic pain such as neuropathy. For most of my patients, they've been to many doctors, 5, 6, 7 doctors. And we're at the point ready to give up because they've tried everything. First they've been to the primary doctor. I'm sure you have as well. After the primary doctor gives you some medications, maybe suggests some therapy for you, and to no avail, you don't get any relief of your symptoms. At best, you may get a few weeks, a little bit better, but not much change. And then you go to a specialist, a neurologist, who's an expert at working with the nerves of the body. He again might do some testing. And I'm sure a lot of you have had done the nerve conduction studies. But I have to ask you, from the nerve conduction studies that you have done, what have they really done for you? You know, you get the results back, they tell you got a problem with the nerves. So what does that mean for you? Has it helped you? Or is it just giving you some more information? That's the frustrating part for me, because I see a lot of people, again, with neuropathy that have had the diagnostic testing. They've had the nerve conduction test. You've had the MRIs or CAT scans done. But you're still suffering with the problem. Now, despite all these high-tech diagnostic tests, you know, I want to find out what is the actual cause of the problem. What's going on? Is it a problem with the nerve? Is it a problem with, you know, could be a problem with anemia? Could be a diet and lifestyle change as far as what you're eating, irritating the nerves? I don't know. Everybody is different. But I can say having peripheral neuropathy for patients, what they describe to me is very frustrating, because no matter where they go to, they don't feel like they're being listened to. And if they are, they just feel like they're at a dead-end street. You know, they've been through 5 stops along the way and no one's been able to do anything. And I can sense how you would feel frustrated. I've even had a few patients just recently, they've been to not only specialists in my local area, but they've been to specialists outside my area, a couple hours away even. You know, I understand that you really want to fix the problem, and I don't blame you, because peripheral neuropathy can be very debilitating. It can affect how you walk. It can also affect, obviously, your nerves and nervous system. So when I mention peripheral neuropathy, we're talking about the nerves away from the brain and the spinal cord. And those are the ones, essentially, that go down into the hands and down to the legs, into the feet. Hence why it's called peripheral neuropathy. So I've been treating patients with neuropathy for almost 13 years now. I've seen a lot of cases. I've seen a lot of people that have been every place. And I don't care if you've been diagnosed with neuropathy. I don't care if you've been diagnosed maybe sciatica and it's not sciatica, it's, you know, something else. That doesn't matter. That's just a name. But what does matter is, let's find out what's causing the problem and do something about it, rather than just treating a symptom with medications. Because you know as well as I do, that doesn't work. You know, let's get to the root cause of the problem. You know, if you're sick and tired of dealing with neuropathy, I'm going to make this real simple for you. What I do is I offer 2 free visits to my office to see if we can help you with your peripheral neuropathy. And here's the reason I do this. Number one, there's a lot of people suffering with neuropathy and just simply don't have the right information. So when you come in, we'll give you the information, we'll take a history, do an exam on you. And this isn't no 10-minute exam. You're going to be here for probably about 45 minutes. And I can tell you I can tell by just, again, talking to my patients, when was the last time you've been to a doctor and they sat down with you for 45 minutes? A doctor that took your phone call and returned it usually within an hour. A doctor that responded to your email within an hour or 2. Most of them aren't like that, I can tell you. In my office, we do things different. You are the center of my attention in my office. Whether that's on a weekend, during the weekday, you can get a hold of me. You're not going to be talking to an answering machine. You get a hold of myself. So those 2 free visits, all you have to do, we'll do the exam, history, if it can help you. I'll let you know that in the second visit. There's some people that simply we can't help because they've let it go too long. Those are the people that have to be on medications the rest of their life. So if I can help you, I'll let you know how long it would take, how much it would cost, and what are we looking at. But if you're interested in finding out more about your peripheral neuropathy to potentially change your life, then all you need to do is either call our office at 773-4707, area code 716, or you can email me and ask a question. Or right down below, if you look, there'll be a little form there you can fill out with your name and your address, and we'll simply send you some information more about neuropathy, and from there you can call us and make an appointment. So, you know, if you're at your wit's end with dealing with the pain, dealing with the numbness, and have been to many specialists, don't give up, I can tell you that, because it's often the last stop here at my office that people find some relief. Go ahead, click on our testimonials, read them, watch them, because we've helped out a lot of people, and hopefully you're one of those. I want you to be my next testimonial to spread the word that it can be helped. So don't give up. Again, I'm Dr. Kevin Augustine from the Fast Pain Relief Center here on Grand Island, New York, and I just want to leave you today with some hope that you can get better. I look forward to talking with you.